Good evening, friends. Here we are to celebrate the 10th annual of the YouTube channel and the initiative Anesthesia Tools. I'm Dr. Sanish, founder of Anesthesia Tools. I'm happy to have my colleague, my friend, Dr. Arvind Narayanan, who has joined as a co-panelist with me, senior consultant and associate professor, Adayar Cancer Hospital, Chennai. Good evening, Arvind. Welcome to the program.
Welcome, everybody.
So actually the 10th anniversary will be happening on 16th October, but I thought 16th October being the ether day where anesthesia day, so many celebrations will be happening. So we pre-planned it, and we are doing a live celebration of with a PG quiz this time. So Anesthesia Tools was started as a YouTube channel in 2015, October 16, while I was working in Sultan Qaboos University Hospital, Muscat. So the initial video was this.
Hello and welcome to my initiative for online education named Tools in Anesthesia and Critical Care, the online orations for learning through seminars in anesthesia and critical care.
There it is. It was in 2015. Time moves on, the project moved ahead, and as you can see from the initial logo to the present one, we are in a path of growing or evolving. The idea remains the same, to share knowledge and to be a proud anesthesiologist. Now the YouTube channel Anesthesia Tools is about to hit 10 lakh viewership with a watch time of over 66,000 hours and a good viewership. You can see the track record right from 2015 marked in blue arrow. It goes along consistently with some spikes. Any guesses why these spikes are? Because these are exam seasons being marked on the timeline. By 2019, the website www.onlineanesthesiatools.com was started. That became another platform to share the videos and the teaching materials to the learning people. Okay, this is how the website looks like. And 2025, another landmark, we have moved into an application format which is available in the Google Play Store for an Android devices, Microsoft Store for Windows platform, and iOS app for iPhone users and iPad users. So now whatever be the platform, apart from our MacBook users, you can have this application installed in your Android device, iPhone, iPad, or even you can access it with a big screen experience of your laptop or desktop so that you can see the videos in a much bigger dimension, and you can read the PDF materials and you can answer the questions, the quizzes, the interactive platforms through the big screen if you are using it through laptop or desktop. Each student registering and downloading will be allowed for 2 devices, either one mobile device and one Windows application. So this is the story of evolution of Anesthesia Tools as a anesthesia platform. Now we'll move into the quiz part, for which we have gathered here. I know some more participants are expected. So now this is going to be a test run so that you will be able to be familiar with the package, like what you are expected to do. So scoring, you don't bother about these things. There will be 3 questions, practice questions. So what you do is, in your smartphone, open the Chrome browser and go to www.kahoot.it, kahoot.it, or if you have installed Kahoot app, you can directly go and join with this game pin 3756254. Another option is you can use the QR code displayed on the screen. Okay, I've already mentioned the nickname format should be first 4 letters should be your name, first 4 letters of your name, followed by your complete mobile number. Because if you happen to be the winner, that's the only way I can identify. Because as I mentioned in the beginning, after the quiz, probably only 3 top winners will be shown on the scoreboard, but in the report that I am going to receive, will have all the rank positions. So if I have to select the top 10 and I have to revert back to you, because the price we are offering here is a free 1-year free access to all the courses in Anesthesia Tools. Okay, but still many people are using more letters, 4 letters from your name and then 10 digits mobile number. Okay, still I can see some people going wrong just by entering their name only. Okay, if you intend to have only fun factor only, that's fine, but later on don't tell me that the Teju, the Apu is me, I won't be able to trace it back. So this is a humble request. So next time for your proper quiz, whenever you join, first 4 letters of your name followed by 10 digits of your registered mobile number. Okay, so 40 participants are in. So we'll wait for another minute and then proceed, because punctuality is something we as professionals should have. Okay, so somebody wrote the game pin as the nickname. So don't be in a hurry. Our specialty demands this temperament, right, Erwin?
Yeah, absolutely. I concur. The instructions are pretty clear. First 4 letters of your name followed by your mobile number in order to help us trace you. It's just that panelists are not expected to put our mobile number, so I'm not putting my number, but I'll participate in the quiz.
Not applicable for you.
Anyway, welcome all. It'll be a fantastic experience, I'm sure. It's been well curated and a nice experience.
So we are actually integrating this interactive platform basically to enhance knowledge, because some objective type questions are such that you might go wrong with a small margin of error. So when you go wrong and you get the answer, then you are likely to retain it for longer. So that's how learning progresses.
And we also are able to identify the pitfalls. We watch out for the keywords and look for the closest choices so that we don't err on that. Even though we may know what we are talking about, what we think and what we press on the screen might be different.
It's not only for your exams and all, even for your clinical practice. Sometimes you miss subtle signs and you might be in trouble. Like you don't recognize the tachycardia and the possible sepsis behind and impending cardiovascular collapse, then you might miss out something. So it's all part of life. Okay, I think
43 participants, right, Sanish?
Yeah. But by the time we finish the practice session, I think others might join. Okay, so we'll value the punctuality first. So shall we go ahead? So one more request, I request all the delegates who are participating in the quiz to keep your video, webcam and microphone on, because this is going to be recorded for proctoring purpose. Okay, so this is a normal thing whenever we do an online exam or academic event. This is to be followed. Correct? with all the seriousness, what you get in your exam hall or classroom should be there in the place where you are sitting. There is no chit chat around. There should not be any chit chat around or checking with your senior, browsing. Nothing is allowed. Though it's only a fun part of the academics. We'll practice it just like we do for any formal program. So shall I proceed with the quiz? Okay.
Yep. All the very best to everybody. This is a mock test just to get the hang of it.
Okay. The first question. Who did the first successful ether demonstration in 1846? The faster you answer, better will be your score.
സംഭവം അറിയാമോ? ഇതിലെ ടോപ്പ് ആയിരിക്കും പക്ഷെങ്കില്
Please keep quiet. Keep your microphone on and keep quiet, please. Okay.
സോറി സർ.
No, it's okay. It's okay.
But everybody breathe nicely. Don't stop breathing.
Okay. So you got 30 seconds to answer that because that timer is on your left side. So you can check that. Okay. So 36 people got it right. I know each and every one of the delegates would have received your score and the position now. Okay. Surprising that 1 plus 5, 6 people went wrong. Okay, this is the only warm up. Okay, don't worry. Another 2 more practice questions. You don't bother about whether you went right or wrong. If you know the answer correctly, precision, you go for it faster if you want to be in the race. Okay. If you are in doubt, don't take risk, go for accuracy. Okay, some questions are like that. You have to be quiet, be composed, maybe a little bit more extra thought, you might hit the right answer. So there, being hurried might be counterproductive. So now I think things are better now, clear now. Okay, so this is the scoreboard. Yeah. Okay. I don't think you should be given points for guessing the Morton's name. Okay, especially when you are discussing it in October 14, when October 16, everybody is going to speak about the good old story which happened in 1846. Right? Okay. So nickname, I am reminding you once again, first 4 letters of your name followed by the 10-digit mobile number. Okay. So a little bit about the app Anesthesia Tools. The idea is to have an engaging and interactive learning. It's not going to be a collection of recorded videos and all. It's going to be live sessions most of the time. Live sessions, if you attend, you can interact with the faculty.
Okay.
Okay. So the faculty interaction is something that we would like to promote during this app. So that is the difference from a YouTube channel to an application. Plus, we are working out on a few extra facilities where along with the video, you will be able to answer in a dynamic fashion, because along the video, there will be some questions which you'll be able to answer through your mobile and check your score as you go along listening to the video. Okay. Plus, most of the recorded videos, you'll be provided the PowerPoint presentations, so in a PDF format, of course, and we'll have discussions not immediately before the exam, but well before the exam, because the policy is just a few last 1 or 2 weeks before the exam is for your individual learning, not for combined study or discussions. Before that, you should be getting enough opportunities to clarify your doubts, clear mind, clear concepts, or clear strategy for your exams, be it theory, practicals, vivas, or for DNB's candidates, OSCE. So we have tried to incorporate all these in packages. So as we go along, the contents, the number of videos, the number of interactive sessions will get more and more. So remember how to download this app from Google Play Store, Microsoft Store, or iOS application. Its details are available in the website www.onlineanesthesiatools.com. Only for iOS users, you have to install the app called My Institute, and then the organization code is mentioned here. So once you enter the organization code and then validate with your mobile number, and then you are going to access the proper Anesthesia Tools app even in iOS app. Okay, fine. So here we go with their second question. The induction agent preferred in case of impending cardiovascular instability. 30 seconds. Another 15 more seconds. Easy questions, right? Easy questions. Okay, here also 45 got it right. Unfortunately, only one got it wrong. But still, we will have a differentiation because those who are quick will get the better score. Any doubt? What is the answer? It's etomidate. The word cardiovascular instability was the clue in the clinical scenario mentioned. Yes, Anup retains the place. Okay. So question number 3, the horizontal line that connects the highest points of the iliac crest is called I think people are very quick in answering. Still wondering who got it wrong. Maybe out of Haribare. Okay, so 45 got right. So here's the mock test podium. Number 3, number 2, and number 1 place Anup. Right from question number 1, Anup has been relentless, right? Okay. Okay, that's the mock test part for you. Hope the technical part of it is clear for everybody. It's clear? Any doubt you can put in the chat box. Okay. So next quiz, when we start, it's going to be the formal one. Any doubt? I don't see anything. Yeah, if there is any time lag, it must be an internet issue, right? So,
Sir, can you please tell me the pin again?
No, formal quiz, there'll be a different pin.
Okay.
There'll be a different pin, different game, different game pin. So, any doubt? We'll clarify before proceeding. Any doubt? So, okay. So, hello. Kindly remember that your microphone is on. So kindly reduce the background noise. Okay, you can attend both meeting and quiz in the same phone. That's okay. Okay, no problem. because all the questions and all the options will be displayed on your phone also, the phone screen as well. Yeah. So I'm going to share the new pin. Okay. Again, preferably take a new browser tab, www.kahoot.it, because sometimes your nickname, if you have gone wrong last time, might continue. Okay, now it's better.
Dr. Sanish, I have a small doubt.
Yeah.
Do they get points for joining in early? The first joiner gets more points. Those who join late gets less points.
No, nothing like that. So one thing I need to remind you, because 3 questions will have double the points. Suppose one question carries 1000 points, 3 questions. Before that, there will be an alert. So there'll be an opportunity to get ahead of your people who are already in front. So that can be the game changer, because one question in between and the last 2 questions will fetch you double the scores. And there'll be one question to arrange the sequence, for which in this edition of the PG quiz, I haven't kept any points. So that's a leisure free hit for you, so that our subsequent online programs will have more interesting formats of types of questions rather than the single best answer. We'll go ahead with multiple answer questions, objective, and lots more will be coming, making in sequence, like they arrange in the order of toxicities, like that we can have questions. So this is for your familiarity. Those kinds of questions are in the pipeline. So happy that all are putting the nickname in the proper format. Whether your mobile numbers are correct, only you will be able to recognize. Because even during registration, many people went wrong with their email ID. Spelling mistakes in the email ID means you're not going to get any communications. And some people registered with say 9-digit mobile numbers, and also we won't be able to contact you or trace you back. Okay. Fine. All set. We'll wait for 1 more minute and then go ahead so that we can finish early. All set. I'm waiting so that nobody should be left out, but we have provided extra time for those who could not join exactly at 7 o'clock. Now it's 7:24, so it's good enough. We'll move ahead. Okay. Okay. PG quiz for Anesthesia Tools, October 14. Here we go. 3, 2, and 1. Yeah, we are celebrating 10 years of Anesthesia Tools YouTube channel right from our start in October 16, 2015. 10 years down the line, we are actually celebrating it online with postgraduate colleagues. Happy to have Dr. Aravind joining with me. So this is their website, onlineanesthesiatools.com, where you get all the details, including how to install the Anesthesia Tools app for Android devices, Windows platform for your laptop or desktop, and iOS app. Remember, iOS app, we are actually installing the My Institute app, and then enter the organization code mentioned here, and then validate with your mobile number, and you are getting the Anesthesia Tools app, which will have some free contents as well as the paid courses. Each course will have its own contents and philosophies. The courses will have live classes and recorded classes. Here we go with the first one. The following drugs are metabolized by esterases except. Four options there. Please don't speak out the answers. Options are there. Choose wisely, preferably quicker, so that you will get better scores. Yes. Yeah. Now when the formal platform starts, we have all the responses. Cisatracurium is the right answer. How many people got it right? Only 14 got it right. Succinylcholine, esmolol, and remifentanil all have metabolism through esterases. Cisatracurium, everybody knows about Hoffman elimination, right? So this is the scorecard. Now we have a new winner, but our previous winner is still there in the second place. Keep it up. Yes, very narrow margin between the top 5 contenders. Great, good going. So drugs metabolized by esterases, all big list is there. There is aspirin, enalapril, there is heroin, cocaine, lovastatin, remifentanil, esmolol, succinylcholine, prasugrel, olmesartan, all are there. For cisatracurium, the metabolism is primarily through the organ-independent Hoffman elimination, not via esterases. So answer is clear? Okay, so we move ahead to the next one. So top 10 winners of this quiz are entitled to get 1 year free subscription of Anesthesia Tools, including the paid courses. So you can explore the materials, and we are always open for suggestions. Feel free to write your suggestions, and we'll try to incorporate your suggestions, all the worthy suggestions. So our idea is to have more engaging and interactive learning. Okay, the next question is in the way. In a young patient with extensive soft tissue and muscle injury, which of these neuromuscular blockers might lead to cardiac arrest? Atracurium, succinylcholine, vicuronium, procuronium. Okay, time's up. Oh, great consensus. 47 got right, succinylcholine. I thought it's a very simple question. Arvind, would you like to go through the answers? Before that, I'll show the scorecard.
Yeah, I guess this is to start with our basic theory, and everybody got it right because the new potassium release by succinylcholine, hyperkalemia, and already patient is having crush injury post-trauma, and that's not bad. That's very bad for the heart. The heart stops, hyperpolarization. So I guess that's nice thinking. It's ingrained, should be ingrained into our DNA. Whoever manages patients, crush syndrome, long duration surgery, rhabdomyolysis, trauma. The list goes on.
Okay. Once you look at the scoreboard, I think there are 2 people who got promotion. Upward arrow for position number 1, 2, and 4. Okay, Anub managed to get into the top place. Okay, congratulations. So as of now, I think everybody will be getting their position in the list on your devices, right? So it's just a beginning. We are through only 2 questions. So this is what Dr. Arvind was explaining. Hyperkalemia, something we need to be very, very off, especially with extensive muscular damage or muscular diseases. So we are through with the 2 questions and the third one. Another 20 seconds. Your accuracy matters. Speed of answering will be reflected in the scores. Yes. Arvind, that was again a easy question. No? So more than 95% getting it right.
Yeah, good. I think we are testing the basic grasp of equipments. And hypoxia is a dreaded enemy for anesthesiologists. So I guess it's nice to have everybody thinking. Still, there are some doubtful people who are thinking that about 7 of them, I guess, who still feel that there's some different reason for this. But I guess delivery of hypoxic gas mixture is the primary top answer for this.
Yeah, I think that's the beauty of these objective type questions, especially with this timer concerns. Because in the race against time, if you compromise accuracy, then you will be out of the race. In clinical condition also, accuracy matters more. The speed of decision making is sort of secondary, but this is the fun part of it, academic part of it. So let's move ahead. Yes. Now, new person gets on top who got promotion. I think all the 5
This is just
are
to
getting
motivate
promotion.
everybody. Come on. It's me, it's Arvind. But it's just to motivate everybody that all of you are doing well. So don't worry, I'll be dropping out. I'm only the person setting the race trend for you all. Good. All the best.
Okay. Anyway, if you speak about even the other 4, all got promotion. I think the person on number 4 was in 5 before and got into the 4th place. So gradually climbing up. Okay. Somebody got climbing up by 18 places. Asha. Okay. So things are happening. There are 2 rounds with double the point. So the sequence is attainable for anybody. It's still anybody's game. So we'll move ahead to the next one. So this is link 25 mechanism. That is one of the proportionating mechanisms that we were discussing about. So remember that the question's wording may not be so obvious. So we have to understand the question and then try to get into the answering mode. Next question for double points. Be careful. An each cylinder of oxygen has 2000 psi pressure. In approximately what time frame will the cylinder be depleted if used at 5 liters per minute? You are getting extra time because it's a double pointer. Still 25 people have answers. Again, it's nicely distributed, not our exactly bell-shaped curve, but B and C had more responses, but the answer here is 2 hours, 120 minutes plus, somewhere around 120 minutes is the answer. How do we reach the answer? We'll tell you. Before that, we'll have a look at the scoreboard. Yes, you can see new faces in the scoreboard. Yeah, one more stats they have mentioned 10 participants have reached answer streak 3 because they got 3 back-to-back right answers. So this is the scorecard as of now. If you eliminate that first person,
maybe we should. Yeah, I will eliminate myself. Don't worry. I'll go out of the pace setting. But maybe all answers should have been in minutes. We had 2 answers in hours, 2 in minutes. Maybe they got confused.
Yeah. Okay. Fine. So kindly remember that your microphone is on. Kindly keep the ambient noise low or silent if possible. I hope everybody is listening. So whenever you are on a webinar, there should not be ambient noise. I am requesting you to keep the microphone on only for the proctoring reason. Okay. So medical oxygen cylinder, the full cylinder contains a volume of 625 liters with a full pressure of 1900 or 2000 psig. So if you are consuming 5 liters every minute, 625 by 5 is 125 minutes. So it's around 120 minutes, that is 2 hours. So unless you know this value, you won't be able to reach the answer. But these are basic things. How much is the full cylinder, E-cylinder, full pressure, full volume, you should be knowing. So some of the question papers will not give you that clue. So we move ahead to the next one, question number 5. Which of the following would cause an abrupt decrease in the end tidal carbon dioxide during general anesthesia? You can see the graph there. Is it hypothermia? Is it sepsis? Is it pulmonary embolism? Or a release of tourniquet? This is not a double pointer. Only 30 seconds. Another 12 seconds remaining. Hardly 1 or 2 people to put their answer. Yeah. Yes, there is a huge consensus and in the right direction. Pulmonary embolism is the correct answer. All the other scenarios, hypothermia, sepsis, and even release of tourniquet, there will be rise in CO2, EtCO2. But yes, sepsis, when it goes to a cardiac arrest scenario or shock state scenario, things might be different. But generally, sepsis is a hypermetabolic state. Hypothermia also is almost the same. Release of tourniquet, suddenly there is a release of waste metabolic materials into the general circulation. So there will be increased demand to eliminate CO2 after release of tourniquet, especially after long duration surgery, especially when the tourniquet was released from a lower limb. Pulmonary embolism is a classic case of a sudden drop in EtCO2.
So no perfusion and no CO2.
Yes. So the scorecard is being revised. I think the position number 5 Dr. Nila is retaining the 5th position. Okay, we have a new winner at this stage. 6 participants hit the answer streak of 4. That means 4 back-to-back correct answers for 6 participants. I hope next session, next time whenever we are conducting a similar online PG quiz, there should be more participants getting back-to-back answer streaks of maybe 6, 10 like that. So that's how we improve. There is always scope for improvement. Okay, as I mentioned, the Anesthesia Tools app will have live courses which will be accessible to all the participants, those who have downloaded the app and joined the course. And the recorded courses will be available by default to them. And some of the recorded courses or some of the uploaded videos will try to incorporate the interactive feature. So along with the video, you can have a self-assessment or self-learning so that learning becomes more enjoyable because you can attempt those questions, get the score, and get along with the lecture or the video and see why you went right, went wrong, or even if you have gone right, whether there is something more to it. Okay, so the top 10 winners of today's session, what I am offering is 1 year free subscription of Anesthesia Tools courses. So we move ahead to the question number 6. What is the name of the lung volume at passive end expiration? Normal points. Another 13 seconds. Yeah. Surprising, it's again a bell-shaped curve. But the right answer is B, functional residual capacity. I don't think this needs so much explanation, but what we will be interested is to see this scorecard. Yes, the top position is being retained compared to the previous position. And there are 3 new people climbing up in the top 5 spot. And 5 participants just hit answer streak of 5. That means for 5 participants, last 5 answers were okay. So lung volumes and capacities, we're not going to the explanation part of it. We'll move ahead with the next question. Select the correct flow volume loop for pulmonary fibrosis. Okay. This is a flow volume curve. Curves are labeled as A, B, C, and D. Look at the picture carefully and hit the answer. 12 more seconds.
what shift होगा सर?
Time up. Yeah.
मुझे पता नहीं सर.
Arvind, would you like to take us through the answer part? 31 people got it
Yeah, I
right.
think this is sort of basic what we learn when we learn about flow volume loops, the inspiration, expiration. We look for the normal pattern and then look whether it's the inspiratory limb or the expiratory limb, whether one of them is reduced or both of them are reduced. And I think the totally shrunk curve, the last one, should have been a clue for everybody. But this took a little while even for me to understand the color, the A, B, C, D, and then align it to that. So maybe that's a challenge for most of us, but good. I'm sure all of you know this basic. It's nice to keep it in your mind, the visual impression.
And in the diagram, that ABCD was not in sequence. A, C, B, and D was the labeling. Anyway, we'll go and check this scoreboard. Yeah. Dr. Nila has been promoted. And then I think it's Anand is climbing up. So Juma has been a consistent winner. So up 9 places, one person is the highest climber. So there is something we need to look up to, because next you might be having a double scoring round. So whatever you score will be double the score. So any upset is possible in the subsequent things. So this is what Dr. Advin was explaining. No negative points. No negative points. Okay. So we'll move ahead. Okay, in AnesthesiaTOOLS app, there are options for some free tests. It can be a rehearsal test so that you can time yourself, or it will be like an actual test where there will be a timer compelling you to finish the answers. So there are lots of different types of questions possible there, including the best answer, single best answer, multiple best answer, true false type, and various other types which you will come across for exam preparations, like if you are preparing for EDIC, EDIC, or even part 1 FRCA. So such questions will be incorporated. So you can attempt, you can get the score, and keep your progress with yourself. So that option is there. So it's my request to install the app AnesthesiaTOOLS and explore these features. Another feature we'd like to highlight is the one-to-one Meet Pro Club option. If you want to have a case presentation with the examiner in a one-to-one basis, that also we can schedule and get it done. We can also have doubts clearance sessions and maybe strategy planning sessions, be it for Vivavus, OSCE, or even theory. So there is an option to have opt for 1:1 call. So you can get a schedule, you can see which schedule the faculty is available, then you can fix it up, and then we can have one-to-one interaction. So these are the extra features we would like to announce that you should be aware of. So make use of these features in AnesthesiaTOOLS. Ultrasound image of an interscalene block shows the following sign. The picture is given there. It's a normal question. 4 options are there.
എനിക്ക് ആൻസർ പറഞ്ഞോളൂ.
Okay, everybody is in search of answers. The microphone is on. Yes. Verify I got it right. Time up. Okay, it's all part of the game, no problem. So if you look at the question very carefully, you can see that a few artifacts are mentioned there, and including one sign. I think interscalene block, the first thing that comes to our mind is top light sign. Okay. Yes. The scoreboard, the topper is still unwaveringly topped. Okay. The second place also now consistently holds the place. The other 3 places, we have new faces coming up. Those who got ahead by many places. Okay. And one person, highest climber, got ahead by 9. So another next 2 questions, I think, are double pointers. So those who are missed out this time, you can make it up with the remaining questions. Okay. Yeah, double points.
Acetylcholine binds to
Question
which
number 9.
subunit of
Acetylcholine
nicotinic?
binds to which subunit of the nicotinic acetylcholine receptor on the skeletal muscle? Alpha, beta, epsilon, gamma. Ten more seconds. Kindly remember that your microphone is on. Kindly keep a silent or low noise ambience in your place. Yeah, 29 people got it right. It is the alpha receptor. So this is something that we learned during our first year of training. We happen to forget it, but for competitive exams, points like this are very important. Again, the scoreboard, the topper has a firm lead now, and the second place person is also firmly there in the second place. Next three, we have people who climb the ladder. Okay. Yes. Scoreboard looks interesting, but remember, it's not the top 5 which who will be getting the 1-year subscription of Anesthesia Tools app. It's the top 10. Okay, so another 5 more people are there. I think in your mobile devices or screen, you'll be getting your place, right? Your rank place also will be displayed there. Okay. So this is the answer key. These are the alpha units, and the acetylcholine binding site is there. We'll not go into the theory part. Yeah. So before we conclude, 2 more questions are remaining. Kindly rate, are you satisfied with the academic content and competitiveness of today's session? Because I know this feedback has to be taken before we wind up. So there are still another 2 more questions remaining. One without scoring, of course, to make you aware of the type of questions which is coming up in the subsequent sittings. Okay. If everybody puts the score, then I can move ahead with the next one. Yeah. 43, another few more people, just to mark your opinion on how this particular session went, because next session we can always modify. It's always a case of going up the ladder or improving every time. Okay, fine. So we'll move ahead. Yeah, this is a puzzle round. It's a free hit round. Arrange the steps in rapid sequence induction. So next quiz onwards, you will have questions in this format as well. So you can, I think, Android devices, you can just drag the options and put it in sequence and see whether you get the correct sequence. Rapid sequence induction. So the job at hand is to get it in this sequence. Acetylcholine, pre-oxygenation, tracheal intubation and confirmation, induction followed by Selix maneuver. One last scoring question is remaining after this. Yeah, another 8 seconds, we'll wind up. So next quiz, we'll have options like that. It's not only single best answer, it's going to be multiple response and all. Okay, here it is. This is a sequence. Rapid sequence induction doesn't mean that you should be in a hurry. You have to be meticulously planned before going in. You have to start with pre-oxygenation. Then you give an induction with pre-calculated dose of the induction agent, whatever dose you have decided depending on the clinical condition. Then Selix maneuver comes into play. Then you are relaxant. Then tracheal intubation confirmation. I hope everybody got a feel of it, how to change the sequence. Next time then it will be like arrange in the order of potency, arrange the order of toxicity possible, or your order of preference in different anesthesia like regional anesthesia, first, second is general anesthesia, third is MAC, like that. If you are asked to put it in sequence, in the order of choice, say for example, ACLS sequence, what next, what next, what next can be asked. So I hope you're all familiar with how to arrange these steps in sequence. So if that is the case, the scoreboard won't move because there is no scoring attached to this round. Okay. So we move ahead to the last question of today's session, that is double points. A highly sensitive test is defined as which of the following? A test that correctly classifies those with the disease, a test that correctly excludes those without the disease, a test that, if negative, indicates the true absence of the disease, a test that, if positive, indicates the true presence of the disease. Answers are pouring in, 20 more seconds. Time's up. So the right answer was option A, test that correctly classifies those with the disease.
9.
The highly sensitive test. Okay, fine. So biostatistics is something that is very important during your training period because whether it's for your thesis or for your exam, because Viva exam, there is one station dedicated to this. And for DNB students, definitely, okay, this is a favorite area. So biostatistics is highly rewarding. And I would say it's very essential to study in any competitive exam in anesthesia. So now it's time to see the scoreboard. Before that, the answer key. I'm not going to explain this because this is not an opportunity for theory discussion. Definitely, we'll have a package incorporating biostatistics lessons. Arvind, shall I move to the scoreboard?
Yeah, I think statistically we should now see how they're all placed. So statistics plays an important part in all our lives. Now we are classifying them based on the accuracy, based on their attention span, and all the very best to the winners. And I'm not among the top 10, so that will be great.
Okay. So number 3. Number 2. Yes. Consistent winner. Congratulations, because you have been very consistent right throughout the quiz session. Deserving
we
winner.
have also Anoop joining in at third place. I think he's caught up with the last few questions. Very nice.
Great. So it's been a fantastic journey. I hope everybody enjoyed. So I'll get the session summary and the report of your scores, and the top 10 people will be contacted, and the Anesthesia Tools app free subscription will be open to the top 10. But it's not only for the top 10. Like I request all the participants to download the Anesthesia Tools app, explore the courses, be part of it. If you have any suggestions, any requirements, feel free to communicate with us. So I'll be trying to incorporate that. So before your exams or your thesis, if you want to have one-to-one discussion, there is an option. Make use of that. Fix up an appointment. So you can have a case presentation, doubt clearance, strategy discussions, or post-exam counseling, whatever. It will be available. That facility is there. Once you install the app, you can see for the slots available. Make use of it. Make learning happy is what we try to do with the Anesthesia Tools app. From delegates part, if you want to give any comments, you can feel free to let us know. We're open for your suggestions. How did you enjoy today's session? Was it as per your expectation?
So number of questions should be declared initially also.
Okay, so that you can plan.
Yes.
Okay,
Because
fine.
at the end only we came to realize only this was the last question.
No, because I was telling now 2 more questions there and 2 double pointers. Okay, Good suggestion. We'll take it into account. Yeah. Fine. Anything else? The format, did you enjoy? Anybody had any technical issues?
It's great.
Okay. So
Maybe
once you
somebody,
download the app,
if I can come in, Sanish, maybe some
yes,
of them
yes,
would
yes.
have felt it is too basic or too easy. Possible, but that is how learning goes on. It's not about motivating, it's about understanding. These are the very core concepts that Dr. Sanish has touched in these 10 questions. And I think we learn from the basics, strengthen our roots. As we go forward in this journey, we will be getting more and more complicated questions. But this, I think, platform is not to get the very unusual questions or very rare questions. That is not the objective of this platform. It's for all of us to collectively learn and drive home the important pointers through these questions and answers. Am I right, Sanish?
Correct, correct. I think those who have gone wrong, I don't think they didn't know the answer, maybe because of that pressure of the situation and all. So we have to get used to it. Like we have to have a small, firm, calm, composed attitude to tackle our everyday issues as well. So you can't say that I didn't realize it's an ancestral because I was tense. So that answer is not applicable in our real life practice. So be in tune with the exam systems. Objective exams, always you have to hit the right button. So there is no near best answer. There is only one answer. So that's how these questions are framed. That's how our international exams are held. So let's be familiar with that pattern. That is
That's
one
true,
message.
Sanish. That's true. I think even they will be working in different institutions later on, and most of the devices, monitors have touch screens nowadays. So there's a lot of integration going on between our internet and what devices we have. So this gives a platform in which we want to enable everybody to understand things, process information quickly, come down to the answers, and then put it across. I hope it helps them in that context.
Once it gets into a habit, it comes naturally. That's how we see some of the senior consultants very admirable, because the way they pick up the subtle clues and understands why this plan is not working because there is a contraindication. So some of the brand names of our drugs in India, that is the biggest thing. You may not realize that it's an antiplatelet or anticoagulant. So during your pre-anesthetic checkup, you have to make it a meticulous practice to decode all the medicines the patient is receiving, whether it's their own medicine or prescribed by the colleagues in the other specialties. It's our responsibility to see that we eliminate all the contraindication. After giving spinal, somebody says, "Oh, sir, that was the trade name of warfarin," then you'll be in trouble. So that acumen, you get it through the training. That is one objective of similar exams and all. So I think some of the blood gas reports and I think Western exams and all, you might get the values in kilopascals and all. So you may have to convert it into our familiar units and do it. So it's all part
The
of the game.
commonest is capillary blood glucose levels.
Yes.
Milligram per deciliter versus millimoles. So I think it's something which we need to integrate. And sometimes we will introduce that in the subsequent quizzes, not to confuse, but to make your mind think.
Yes, correct. So I think with that, we can conclude today's session. So I personally, I would say I enjoyed listening to it. I enjoyed your participation. So thanks again to Dr. Arvind for joining me as a co-host, and he's an excellent faculty, very nice person to interact with. So please make use of faculty like Dr. Arvind. Actually, you might be familiar because some of our AnesthesiaTOOLS YouTube videos, Dr. Arvind is featuring, especially the one with Ambu bag. We had a video on depth of anesthesia monitoring and things like that. So we'll be in the
I'll start
team.
reading more and more. I have to compete, especially with Juma and Anup. Good.
Correct.
All the very best to everybody.
Okay. All the very best. Hope you enjoyed. Thanks for joining in this occasion of 10th anniversary celebration of AnesthesiaTOOLS. Happy to be with you all, my friends. Thanks. Good night. Swastika, we can close the session.
Okay. So thanks to all the dignitaries present here. Clarity is really glad to have all these brilliant people together in this session today. And I really hope that you all had a seamless experience. So with everyone's permission, I'm concluding the session in here for today and looking forward to host you again. Thank you so much, everyone.
Thank you. Thank you very much.
Thank you. Good night.
Thank you, sir.
Good night.
Thank you, sir.
Thank you, sir.